Welcome back to Grim and Whim. Today we will be looking into four bizarre medical conditions that could show up in an unexplained way, and some that don't currently have a cure. Before starting, I want to be clear that people who have these conditions, they are not the ones that are weird or strange. I'm talking strictly that the medical conditions that they have are what are strange. And in no way do I want to make anyone feel like they are other due to a condition that's completely out of their control. But without further ado, let's go ahead and look into these medical mysteries. First up, we have a rare skin disorder called methemoglobinemia, and it's otherwise known as blue skin disorder. Someone with this very rare skin condition could look like a member of the Blue Man Group or a Smurf. And this condition causes a bluish hue to the skin. Also, it may cause purple lips or purplish looking tongues. And it also causes brown coloring in the person's blood. The cause of this condition is overproduction of methemoglobin, which is a form of hemoglobin. And humans typically have 1% of methemoglobin, and a person with this disease can have up to 20%. And this excess of hemoglobin is unable to properly distribute oxygen throughout the body. And this is what causes a person to have this bluish hue to their skin. They start to resemble almost like Violet from Charlie and the Chocolate Factory, where she eats, that special gum that Willy Wonka created, and Violet starts turning violet. And it's not just this strange coloring of the skin that causes people with this condition to suffer. There's actually quite a few symptoms that can also come with this, bizarre skin coloring. And symptoms include bad headaches, fatigue, tachycardia, seizures, and some people even go into a coma. There are many ways that this condition can come about, such as exposure to nitric oxide, local anesthetic agents, pain-killing medications like benzocaine and lidocaine, nitrates, which are chemicals used in food preservatives and well water, and herbicides used in agriculture can also be a cause. And in some cases, the condition is simply genetic. Since it is so rare, there is still quite a bit of research needed. And so there will likely be more information about this condition in the future. But one interesting case of this condition is in the Fugate family. And this historical family became famous due to so many members of this family having this blue skin disorder. And honestly, I could devote an entire episode to the Fugate family because they really did lead very interesting lives. Next up, we have alkaptonuria, which also goes by the names black urine disease, black bone disease, or AKU. And I'm going to continue to refer to it as AKU. And basically, AKU is an extremely rare and genetic metabolic condition that stops a person's body from breaking down a chemical called homogentisic acid, or HGA, which the body naturally produces during the digestion of food. The HGA builds up in the body, and over time, it leads to black and brittle bones and cartilage. And the patient will experience joint pain caused by osteoarthritis. The buildup of HGA in the body can also lead to other symptoms, including black urine, heart complications, kidney or bladder stones, bluish black discoloration on the skin and eyes, And there has even been research that suggests a possible link between AKU and Parkinson's disease. The symptoms will vary person to person. However, all patients with AKU will unfortunately experience the pain that comes with significant damage to bones, cartilage, and tissue. And AKU affects one in every 250,000 people worldwide. And while there is no cure currently, it can be treated using the drug nitisinone, and many doctors also suggest a controlled protein diet, exercise, and pain management techniques. This medical condition certainly causes the patient to undergo a lot of chronic pain, and it can be incredibly debilitating, even so much so that the person can't work, they can't navigate, their homes or, around their neighborhood without, significant pain. And so their mobility a lot of times will decrease. And it can be very, very frustrating, especially if they aren't able to, sort of catch it early on and a lot of damage has been already done to, the bones and cartilage and tissue. And while it is, technically right now not curable, hopefully with more time and research, there will be a way to not only treat the symptoms, but maybe even reverse some of the damage or prevent the condition entirely. The next medical condition generally occurs in children 15 years and younger, and it sadly has some horrific symptoms that no child deserves to face. The condition chronic focal encephalitis, or Rasmussen's encephalitis, or RE, is an extremely rare inflammatory neurological disease that affects the brain, and symptoms include frequent and severe seizures, loss of motor skills and speech, and in some cases, it can even cause dementia. And RE typically affects one hemisphere of the brain. And as of right now, neurologists and other experts who specialize in the science of the brain, they really don't know the exact origins of this condition. And in some patients, RE is caused by bacterial infections. Sometimes it's viral infections. And other times it is simply caused by an issue with the immune system. There is technically not a cure for this rare condition, but there are treatment options. And while some never make a full recovery, and many will have irreversible brain damage, some are able to fully recover, especially if they are treated sooner rather than later. Like most medical conditions, if you are able to have access to, regular doctor visits and you're able to get early detection and they're able to treat it right when they know what's going on, this can really give doctors the best success in reversing some of that serious damage that RE can cause to not only the brain, but the whole body. And I'm just going to hop on my soapbox real quick and just say, this is exactly why America needs to adopt the universal healthcare model, because everyone should have access to healthcare. That should be non-negotiable. The sooner that this medical condition, and really all medical conditions, the sooner that they are detected by the doctor or team of doctors, the sooner they can start a treatment plan. And this really lessens the serious damage and the consequential symptoms of whatever disease that they are treating. If people are able to access healthcare the way that they should without it causing detrimental ruin to their lives, and their bank accounts, if they're able to access healthcare, get the treatment that they need, then they're able to contribute to society. They're healthy, they're able to join the workforce, they're able to contribute to the economy, buy things, it all goes together. And so hopefully one day everybody will get on this bandwagon, but it is so important that every single person has access to healthcare and is able to prevent, certain diseases, prevent certain conditions by, getting the vaccinations that they require and the treatment, and be able to do, preventative screening, things like that. All of that type of stuff that goes into healthcare and being a healthy person, when people have access to it, I think that it makes all of us better. And many might think I'm naive. I personally don't really care, but I know that many countries have adopted the universal healthcare model and their citizens are better for it. And there's evidence in the health of their citizens. And so I'm going to hop off my soapbox and let's go ahead and get into our final medical mystery. The final medical condition that we will be talking about today is called pseudobulbar effect, or PBA, and it is more commonly known as laughing sickness or laughing disorder. This medical condition is linked to brain damage from conditions such as Alzheimer's, ALS, or traumatic brain injury. And if you've seen the 2019 film Joker with Joaquin Phoenix, then you'll have seen some of the symptoms of this disorder. While the film never explicitly states what Arthur Fleck, aka the Joker, is diagnosed with, many people believe that Arthur's symptoms are based on this very real disorder. Patients with laughing sickness or PBA, they are plagued with sudden, uncontrollable fits of laughing or crying, and it's completely unrelated to their mood. PBA is a neurological condition, not a psychiatric condition. And the involuntary fits of laughing or crying, it can be extremely frustrating for people as they try to lead normal lives. While this condition may not seem as serious or life, altering, especially compared to the others that we've discussed, the symptoms of PBA come about randomly and they are uncontrollable, and it can be very difficult to stop these fits of, laughing or crying. And because it's difficult to stop, this can cause the patient to have a lot of embarrassment. They might face social isolation, or they may develop anxiety, depression. And I can imagine it would be extremely difficult to have this disorder. Many people with PBA find it difficult to hold down a job. They might feel intense embarrassment when they're in situations where silence is expected, like going to the movies or going to see a play or going to a museum. Or just imagine having an uncontrollable episode while you're going through airport security. It makes a lot of social situations really awkward, but it also can make it very dangerous.
There are... I have a condition. I'll tell you what you have, asshole. You got a kicker, huh? Hey, hold him steady, hold him steady. Stay down, freak.
Fortunately, patients who have PBA, they can be prescribed antidepressants or other medications to curb some of the symptoms and help decrease the severity of these episodes. However, it is also recommended to find a support group with other people who have PBA or other similar conditions. And attending therapy sessions is incredibly important to learn how to cope with these symptoms and to best prepare oneself for taking on a world where they might not be as accepted just due to the fact that not many people may be familiar with this condition. But with all that being said, I really hope that you enjoyed learning about these bizarre and rare medical conditions. And if any of these symptoms seem familiar, definitely reach out to a healthcare provider. I always say be kind to your mind, but remember to also be kind to your body. And I need to take my own advice because I am one of those people, I'm very stubborn. When symptoms rise up, I'm very stubborn. I want to just push through things, and I don't always take my own symptoms as seriously as I should, but it's very, very important to get the help that you need and not feel silly asking for screenings or asking for, support with symptoms that come up. It's all about taking care of your body, and it's your only body. You're only born with one. So it's sort of important to take care of it. But with all that being said, stay safe out there, and I will see you in the next one. Thank you so much for joining me. It's goodbye for now, but I hope to haunt you again soon.